Hello, today we're going to present ARES range. This is Mesogel range, Advanced Regenerative Aesthetic Solutions, ARES. It consists of 4 different high-quality products: anti-age, dermoreconstructant, antioxidant, and the hair booster. Hyaluronic acid used in the ARES range is a mixture of 3 different molecular sizes hyaluronic acid, customized by Italian pharmaceutical company. Hyaluronic acid used in the ARES range is CE mark quality and FDA approved for injectables. The real innovation in our patented product is based on a technique to filter the hydrogels under the vacuum and not exposing it to the high temperatures. It means the hyaluronic acid, vitamins, and other ingredients such as peptides in the mix formulation are preserved during the whole process of production chain, which allows for the stability of the components, quality, and shelf life stability as well. The first product in the range is ARES Anti-Age. It's used on the skin which is aged, wrinkled. It can be used in order to help to prolong the Botox effect, but also instead of the Botox effect. It stimulates the proliferation of the collagen and elastin. The main ingredients in the ARES AA is 3 different sizes of hyaluronic acid, 30 milligrams in milliliter, different sizes such as 0.5 megadalton, 0.25 megadalton, and 1 megadalton, and different peptides. Peptides which are going to boost the skin, which are going to boost the proliferation: acetyl tetrapeptide 11, pentapeptide 3, tetrapeptide 29, and menstrual pentapeptide 8. Those type of peptides will stimulate the collagen production, the elastin production. It will stimulate the increase in the new collagen synthesis. Modulators such as copper tetrapeptide 34, oligopeptide 34, and pal tetrapeptide 7, those will stimulate and modulate the production of the glycosaminoglycans. They will modulate the melanin synthesis, tyrosinate activity, which means that this product is not only suitable, it's not only going to deliver anti-wrinkle effect, but also is going to work on the skin quality. It's going to work on the synthesis of the collagen and elastin, but also on inhibition of the tyrosinase activity, which means reduction in the pigment. These are some results of before and after ARES anti-age treatment. Procedure. The application, we recommend to perform 3 to 4 applications every 7 to 10 days. Treatment areas, it's going to be face and body. ARES AK was developed as a dermoreconstructant. This is the product popularly called skin booster. It was developed as a metabolic stimulator, moisturizers for the treatment of the tired-looking skin, the first sign of aging for the skin which requires revitalization, but also for the treatment of all the different types of scarring, stretch marks, post-acne scarring, post-surgical scarring, as it brings a total reconstruction of the skin. If it comes to ingredients in ARES AK, hyaluronic acid, 2 different molecular weights, 0.5 megadalton and 1 megadalton, 20 milligrams in 1 milliliter, succinic acid, amino acids. Succinic acid in the product is one of the most interesting active ingredients. Succinic acid is naturally occurring in our body, and it's produced in the main vital organs. If it comes to the action of the succinic acid, it activates succinate receptors in the organs in the skin during the hypoxia, which is the lack of oxygen in the organ. We have used this reaction in order to produce a similar response in the skin while applying ARES AK containing 1.6% of succinic acid. Succinic acid works directly on the mitochondria, has direct impact on the mitochondria. It increases cellular metabolism, it increases cellular communication. It will have a revitalizing effect on the skin. It will also have very good effect on angiogenesis, so it's creation of the new capillaries, of the new vessels. That's why this product is perfect to be used for rosacea skins, for the open capillaries, but also for the treatments of scars and stretch marks when we need to rejuvenate the skin, when we need to redermalize the skin, when we need to make sure that the new capillaries are overgrowing the new tissue in order to redermalize it. Succinic acid will have also moisturizing effect on the skin. It is a product used in prevention of allergic reaction occurrence, therefore it's used very often in the medicine. So this product would be suitable for the patients, for the clients who experience negative effects of with other products. ARES AK is safe for sensitive, sensitized skin to be used as the dermoreconstructant. Another ingredients are, of course, amino acids. As we know, amino acids are building blocks of every single cell, so the product is going to revitalize the skin, it's going to rebuild the skin. One of the most interesting amino acids from its glutamic acid, which ARES AK contains, it stabilizes the pH of the skin, which is very important if it comes to redermalization, if it comes to the treatment of different skin conditions, such as, for example, rosacea, or for the patients with sensitive skin. High and low molecular weight hyaluronic acid, so those two substances complete the whole pool of substances used in this dermoreconstructant. They will provide moisture in the skin, they will provide the scaffold for the collagen, so we have the full range of condition which will allow us to obtain absolutely phenomenal results as we are providing complete reconstruction and redermalization in the skin. These are the effects of the therapy of ARES AK in combination with the BioRepeal, and these are two treatments. If it comes to the frequency and the procedure, we are recommending the procedure every 2 to 4 weeks, depending on the patient needs. We need to remember that the more mature the skin is, the more damaged the skin is, the frequency needs to be further apart. So for mature patient, I would leave 3 weeks between the treatments, even 4 weeks, depending on the condition. Please always refer to the specific condition of your patient, to the specific skin condition. Treatment areas is the face and body. When you're treating the eye area, and it's a phenomenal product for the treatment of the eye area, because also of the succinic acid. Succinic acid is increasing the lymph influx, so for the swollen, accumulated lymph around the eye area, this is going to be the best product to go for. You need to remember that if you're using off-label protocol, if you're using procedure around the eye area, we would recommend dilution of the product 1-to-1 with the saline, because of the content of the very high content of the hyaluronic acid. We need to remember hyaluronic acid is going to attract the water, so we don't want to cause more puffiness. That's why dilution is recommended for the treatment around the eye area. We would normally use 2 milliliters per treatment on the face. Around the eye area, if we're just treating the eye area, half of the milliliter around each eye area. Eye area is not only underneath the eye, please don't forget to treat the upper eyelid just under the eyebrow, but also we need to support ligaments, so we're treating just above the eye on the forehead. That will give us the best results, the best possible outcomes for the treatment. For the body or for the rest of the face, we do not dilute the product. We're using product as it is from the bottle without any dilution. 2 milliliters for the face, 2 milliliters for the neck. I use 3 milliliters, 2 to 3 milliliters for the décolleté area. If you're treating face, neck and décolleté, you can use the whole vial. That should be an appropriate amount for the treatment. The next product is going to be ARES antioxidant. Complete innovation on the market. It's the treatment used for photo and chrono aging, for the lack of radiance in the skin, in order to restore the luminosity of the skin. Active ingredients: 2 different weights of hyaluronic acid, 20 milligrams per 1 milliliter. Molecular size is 0.5 megadalton and 1 megadalton hyaluronic acid. Apart from that, ferulic acid, eugenol, ascorbyl glucoside, safranal, riboflavin and curcumin. So the main ingredients, such as ferulic acid, very strong antioxidant. It has protective action for the skin. It has the action of illuminating the skin. It helps to brighten the skin. Very strong antioxidant. Safranal, it inhibits expression of inflammatory markers. So calms the skin, calms all the inflammation in the skin. It has brightening, lightening effect on the skin. A very strong antioxidant, as mentioned before. The next active ingredient is going to be vitamin C. In the synergy with all the active ingredients in the ARES antioxidant, it will help to brighten the skin. It provides anti-inflammatory action for the skin. It helps with reduction of inflammatory markers in the skin. And curcumin improves collagen deposition in the skin. It increases vascular density, which is going to be very important, again, with the skin conditions such as rosacea, with the skins which have tendency to irritations, tendency to pigmentation. All those components in this product are going to help you achieve luminous, bright skin without any pigmentation, without any inflammation. So these are some of the effects of the ARES antioxidant. So as you see, the skin is visibly brightened. Procedure: we recommend 3 to 4 procedures, application every 14 days, treatment areas, face, but also neck, décolleté, and other parts of the body. The next product is going to be ARES Hair Booster. It's a complex solution that is used to treat most commonly seen problems such as hair loss, such as thinning of the hair, prevention of the hair loss, improvement in the microcirculation, improvement in the hair density, in the hair thickness. Active ingredients: hyaluronic acid 0.25 megadalton and 5 megadalton, 20 milligrams per milliliter, different peptides, and active ingredients which will support better microcirculation, better delivery of oxygen, of active ingredients to the hair follicle, which will prevent the hair loss, which will strengthen the hair, which will allow us to achieve very fast results for the patients who need such treatment. So the components which will stimulate the hair growth: SH polypeptide 11, SH oligopeptides, polypeptide 3, SH oligopeptide 4, promotes revitalization of the hair, promotes the strengthening of the hair bulb, promotes growth by stimulating production of the gags, production of the collagen in the scalp. Increased microcirculation is polypeptide 1, polypeptide 9, SH polypeptide 9, and copper tetrapeptide 1. First of all, those ingredients will improve microcirculation, improve delivery of the oxygen to the hair bulb, will improve the delivery of micronutrients, of the vitamins, of the minerals. It will help with vasodilation, improved microcirculation, therefore prevention of the hair loss and strengthening of the hair follicle. Hair loss prevention ingredients: sweet japonica extract and biotin. Biotin is essential in the bulb metabolism. It prevents the hair loss. It's by strengthening the hair bulb, promoting hair growth, promoting thickening of the hair. Sweeter japonica extract assists in the inhibiting action of the 5A ready state. It promotes thicker hair, and it prevents the damage of the hair bulb. And micronutrient supplementation: vitamin B. Vitamin B1, B6 provides the hair bulb with the energy, provides better delivery of the amino acids, which are part of the hair structure and hair bulb structure. Panthenol, it's a precursor of vitamin B5, ensures cohesion in the hair scales, strengthening the hair. Again, provides better nutrition to the hair bulb by better moisture level. Keratin, it's a protein formed in the long chains of amino acids and vitamins, provides the better structure, again strengthening of the hair bulb and strengthening of the hair follicles. ferrous gluconate, essential for transportation, oxygen to the hair bulb. So as you can see, all those ingredients are promoting not only the delivery of the micronutrients, of the minerals, but also improvement in the microcirculation, improvements in the delivery of the oxygen to the area, therefore prevention of the hair loss and strengthening the hair. These are some of the results of the hair booster therapy. Procedure. First procedure, it's the full 3 to 4 procedures, application every 14 days. You can perform this procedure every 10 days. Treatment area, it's not only the scalp, you can also treat the beard, you can also treat the hair loss associated maybe with pigmentation of the brows. So there's different options for the application. If it comes to the methods of delivery of our mesogels ARES, it's microneedling and electroporation. Microneedling is a collagen proliferation, collagen synthesis therapy. It activates all the processes of repair of the skin, of repair of the tissue. It's a minimally invasive technique, which means there's no long recovery time post microneedling. It helps to increase the penetration of the active ingredient into the deeper layers of the skin. It stimulates the cells proliferation. It activates all the different growth factors, keratinocytes, corneocytes growth factors, vascular growth factors. Microneedle puncture through the tiny use of tiny needles, epidermis, endodermis, depending on the depth which is being applied during the procedures, but also increases by 80% the penetration of the active ingredients in the mesogels. So there are different techniques of microneedling, skin needling, microneedling. Everything is a collagen induction therapy. It means it increases the proliferation of the collagen. It increases the thickness of the skin. It helps the skin to become healthier, thicker, more resilient, more resistant to the damage. It will help to rejuvenate the skin. It's a controlled injury, and the word controlled is very important. I'm going to mention a couple of words about the depth where we should be working. I will not mention millimeters because every single person's skin is different. So we always need to remember that these are only recommendations. We cannot recommend you specific depth, as every single patient of yours is going to be different. There are different devices available on the market, of course, stamps, rollers, microneedling pens, with variety of the microneedling depths from 0.25 to 2.5 millimeters, depending on the need, depending on the treatment you're performing, depending on the results you want to achieve. As mentioned before, this is only recommendation. The depth will always depend on the patient's need, on your client's need, on the treatment area. So please do not take it as a set in stone recommendation. Always adjust the treatment to the needs of the patients. So most of the time we're working quite superficially. Please remember that if you carry on very invasive work every 14 days, you might have negative biological effect, which means that tissue is not going to be recovering. You're not going to provide enough recovering time for the tissue. So fibrotic tissue might be created, and this is the effect we try to avoid. When we work on 0.1 to 1 millimeter, there should be minimal bleeding. I'm actually looking for erythema, which is slight redness of the skin. At this depth, already growth factors are being activated. The product is being absorbed by the skin. So we're activating corneocytes, keratinocytes growth factors. We are activating the whole communication avalanche between the cells, which will allow for the redermalization of the skin, which will allow for you to achieve the required effect. The minimum depth which I'm using on the skin for 0.25, 0.30, 0.50, it's a rosacea treatment. Also, please remember the post-inflammatory hyperpigmentation, melasma. We are not treating with very invasive treatments. We're going to be using minimal depth until we see erythema, which is the redness of the skin. The frequency of the treatment, 2 to 4 treatments, also depending on the condition of the skin of your patients. The more mature your patient is, the more dehydrated the skin is, the length between the treatment, the period between the treatments should be longer. So for the patients with relatively healthy skin, with rosacea, with pigmentation, I'm going to perform the treatments every 2 weeks. But for dehydrated skin, for mature patients, I'm going to leave 3 to 4 weeks between the treatments. And the next needle depth, and also please treat those depths as recommendation only. Again, please always choose the right depth for your patients. So for the aging skin, for the first signs of lines, of wrinkles, we are looking for so-called pinpoint bleeding. So if I have a patient with lines and wrinkles, the skin requires revitalization, the skin requires improvement in the skin condition, I might be working with ARES-AK to the pinpoint bleeding point, which means you will see a little drop of blood here and there, but it's not large bleeding. It's activating keratinocytes, corneocytes, growth factors, but it's also activating the redermalization of the skin and the collagen proliferation. The treatment frequency, it's going to be 1 treatment every 14 days or 1 treatment every 2 to 4 weeks, depending on your patient. The only time when I'm using slightly deeper penetration with microneedling with ARES product is the treatment of the deep lines, deep wrinkles, and for this one, of course, I'm going to be using ARES-AA. For the treatment of the stretch marks or of the scars, I'm going to use ARES-AK, and then I'm looking to break the skin barrier. I'm looking for bleeding because I need to disattach the skin from the deepest structures which are forming the scar. This is the only time when I'm using depth such as 1.52 millimeters, but again, please check with your patient. So this is to the bleeding point. So then we are achieving collagen proliferation, redermalization of the skin. Always choose the right product with the correct procedure. So for the eye area, we never use treatments which would be penetrating skin deeper than 0.25 for the eye area, 0.25 to 0.5 for the rosacea treatment, 0.5 to 1 millimeter depending on the thickness of your patient's skin. For the pigmentation, vitiligo, hyperpigmentation, comedonal acne, to influence the proliferation of the fibroblast, proliferation of the collagen, or proliferation of the elastin, I'm going to refer to it as a pinpoint bleeding point. It's usually 0.75 to 1 millimeter. For the scars and stretch marks treatment, please remember you need to achieve bleeding effect. So we're going to be using depths such as 1 to 2.5 millimeters. If it comes to the protocol of use of ARES, of course, we cleanse the skin, we disinfect the skin. I use always alcohol solution to disinfect the skin in order to prevent any bacterial infection, any possibility of infiltration of the pathogens. We are microneedling with the appropriate device with the appropriate depth, using appropriate depth. Again, eye area, it's going to be 0.25, so we've got erythema, then we've got pinpoint bleeding, and finally we've got the bleeding in the scars and stretch marks treatment. We're applying 2 milliliters of ARES, of chosen ARES, on the skin, and then we can microneedle again. So we microneedle, we apply ARES, and we microneedle again. We allow a couple of minutes for the product absorption. After that, we're using post-treatment products, which will allow for us to achieve the prolonged effect. So it's going to be BioRehydra or BioRelief. You can also use 2 of those products in the same procedures, applying SPF, and we deliver such treatment every 2 weeks, every 4 weeks, again, depending on your patient's needs. Use of numbing cream is not recommended with the microneedling procedures. It stops the cellular communication. It slows down the possibility of achieving fast results. This is my personal opinion. Of course, it's going to be different in every single clinic, but for me, use of numbing cream is not recommended. Of course, we can use the combination of BioRepeal CL3 with ARES, and this is one of my favorite procedures. So if it comes to the protocol, we would cleanse the skin. We would prepare the skin with Forever kits, which will allow for the moisturization of the skin, for the better penetration of the BioRepeal product. We will then draw 2 milliliters of the BioRepeal CL3. Please make sure that you mix the product well, that you shake the product well. When you draw the product to the syringe, the product might separate if you put it aside. So please always check your syringe. Please make sure that the product is, that the two phases of the product are combined really well in the syringe. So we apply BioRepeal CL3 onto the treated area. Please remember application size. It's the palm size. It's going to be 1 milliliter. So for the face treatment, we are using 2 milliliters of the BioRepeal CL3. We're using gloves. We're always wearing gloves. We're massaging the product onto the treated area until the gloves become a little bit tacky, so they stick to the skin. Then you know the product was absorbed well by the skin, and from that moment on we're waiting for 5 minutes, 3 to 5 minutes for the product to perform its action, and then we remove BioRepeal CL3 with water. So you can use gauze or you can use towel depending on what you're using in the clinic. The product does not need to be neutralized. TCA is self-neutralizing product. After that, you are proceeding with the microneedling of the skin. So you microneedle on the appropriate depth. You drawing 2 milliliters of the product ARES, depending, of course, on the treatment you're performing. You need to choose the right ARES product. You are applying it on the skin. You can do one more pass of microneedling, allow for absorption, and then apply BioRehydra or BioRelieved and SPF to complete the procedure. ARES product can also be used in combination with electroporation, so-called no-needle mesotherapy. Electroporation has been developed for efficient and safe product administration into deeper layers of the skin without use of any needles. This technology is based on the biological processes that involve temporary breakdown of the cell membrane for deeper absorption of the product, for the penetration of the product through micropores, and this allows for achievement of the fantastic results in the therapy combined with ARES product. Electroporation procedure does not require recovery time, so the patient might continue with the daily life straight away after the procedure. Of course, you can still use BioRepeal therapy before electroporation procedure, so it would be the same step as with microneedling, so the application of the BioRepeal. You need to allow 5 minutes for the BioRepeal to perform its action, and then you would proceed with electroporation. Electroporation also boosts hydration level through the delivery of the drugs into the deeper layers of the skin. It promotes the proliferation of the collagen, proliferation of the elastin. We're using 2 milliliters of the chosen ARES product per procedure. If it comes to the treatment frequency, we recommend one treatment every 2 weeks for 4 to 5 treatments. Contraindications. Depending on the country where you're performing the procedures, depending on the regulations in the country, contraindications may vary, so please always treat it as a recommendation, but always check with the country where you're performing the procedures. But general contraindications: diabetes, kidney disease, so all autoimmune disorders, Hashimoto if it's not regulated, which is quite a common condition. Of course, cancer therapy. If it comes to cancer therapy, depending on the country, you can perform the procedures 3 to 5 years post completed treatment. keloid scarring, autoimmune disorders, which I mentioned before, blood thinning medication that is going to be in the combination with microneedling. Electroporation would not be excluded, and blood disorders such as HIV or hepatitis. In case of the herpes virus, please do not perform any procedures up to 2 weeks post the recovery time. So when the skin is already recovered, when the skin has recovered, then we should perform the procedures, allowing at least 10 to 14 days. Precautions, allergies, cold sores, please allow 2 weeks after the cold sore has completely healed. Eczema, psoriasis, dermatitis, so all the different dermatological problems of the skin, burns and skin grafts, tattoos, moles or warts. If it comes to tattoos, of course you can perform the procedure. I would not necessarily perform invasive microneedling on the tattoo, as it can simply have effect on the tattoo. But all the surrounding areas you can of course treat with the BioRepair with ARES range. Medications, we should be always checking during the consultation. If the patient is taking antibiotics, we should allow for the therapy to complete, and then we should allow at least 7 days. Natural remedies, for example, St. John's wort, which are increasing photosensitivity post the treatment, steroids, Roaccutane, depending on the length which your patient has been taking Roaccutane. It's usually 3 to 6 months. Intolerances are just exclusions. In some countries, it should not apply to the skin treatments of the BioRepair and ARES. Thank you very much for watching the presentation.